Guys, I went to Unacademy. This is a channel by Academy. Live stream. Is my voice clear to everyone? Okay, so let's begin. Today we shall be discussing that is image of. So tonight we shall be discussing and this image I'm and you'll have to decide. You'll have to diagnose both the two. That I'll discuss about types of icon as the plus sub. The plus subscription access to top education country, get to access the live as well, and thanks more than 20 early access. Therefore, you don't have to worry about down the notes during the class. Hi Naga, hello. I hope now the audio is it clear now? Iconic subscription will give you access to step ladder as well, right? So these are very subsidized prices, and on top of that, you can apply my that is RSH 10%, right? So okay, let us start with the for the day. I'll be, as I told you, I'll be images, and you have to answer. Take your time, full 5 minutes. You can take your time, and based on those two, you have to tell me what those two images meant, and then we'll discuss the part in. Okay, the first image. Okay, look at the features, and this is the second image. Understood? Got it? Have an idea now what this is? What does this have an idea? Then you can give your answers in the comments. Try and look. I'll give you full 5 minutes. All those are attending answered. I am trying to classes more active by utilizing these new methodologies like image-based questions are tests also. This also good and our way of change, but adapt our way of. The first image, take your time, look at the feature representing, and this one is the second image. Now you can associate these and tell me what this represents. Okay, guys, try and answer. 5 minutes. Try and recall what all we have read. Guys will have the answer. Also, one very important announcement while you answer, one important announcement is all my YouTube sessions by an session, and in that open house, that will be Academy app. That open house strategy, us any doubts that you have regarding prep, and we can discuss anything strategy, whether whether all these that are available just after I that session at about 10:35. I'll be guys to the Unacademy. That is all. That is when to begin special benefit all those in there right now, and all first and second, and those first their interview tips and as what right time, right? Okay, so last two left for you. Yes or an yes or short answer. Tell me. Last two, guys. The two images you have to make an associate them and then come up with answer. Okay, this kind these quizzes, this quiz I'll be taking throughout the month of February. Okay, image of the day and mnemonic of the day. Thrice or 4 times a week I'll be taking because they are interactive, help you exercise your brain. Try and what is this? This is showing what is present here. Can you guys see the clue? What is this? And can you guys look at the child's color of the color of the child's hair, color of the child's skin? How do you understand? Can you see the support here? Support from the back, help the child hold neck. Now do you understand what this is? Clinching factor, this image, and one from this. All four of these have to associate, arrive at a diagnosis. Last 1 minute left for you guys. Come, all of you, try and answer this. Now I think I have made it very easy. Also, I have another session night that is at 11 p.m. That is on mnemonic of the day. We are discussing one mnemonic that all the mnemonics together, then it gets kind of crammed. So I'll be discussing each mnemonic, one mnemonic that you can remember it easy. It's easy. Okay, so last few, I'll start with the explanation. Okay, last 10 seconds, the explanation. This is the first image. One, have to associate both the all the clinical factors together to arrive at a diagnosis. This is how you will develop your clinical approach. So the time is up for you. Now I'll tell you what does this represent. This is what discoloration of the hair. Okay, this color, there is loss of hair pigmentation. Okay, loss of hair pigmentation. This is what loss of skin pigment. What is, what does both signify? What do both signify? Albinism. Now is it ringing bell? Albinism. What is this? The child is not able to hold his neck. Okay, neck holding you comes in by 3 months of child looks old enough, but cannot hold his or her head. So this means no neck hold. Neck has no neck holding, signifying delayed milestone. Now is it getting clear? Is the picture getting clearer? Albinism, delayed milestones, and this one, this is a test that is conducted in the first week, day 7, and what is this test called? The heat prick test. Is used to test for thyroid hormones also. Test for which disease are we talking about here? Now can any of you tell me disease that requires diagnosis through heat prick test after birth, that has features of delayed milestone, albinism, and others? So the clinical factors, guys, come tell me. What all did we see? Albinism, delayed milestone, and the heat prick test. Okay. Now all these are common features of which disease? I'll tell you some more. One symptom I'll tell you, and then you will be out with the musty odor in. What is this? This is phenyl tone. Yeah. This is phenyl heat. Yeah. Understood? Now, what is phenylketonuria? For that, you have to see how phenylalanine is what? Is phenylalanine an essential or non-essential amino acid? Tell me, phenylalanine is essential or non-essential? Phenylalanine essential or non-essential, and tyrosine is essential or non-essential. Phenylalanine is an essential amino acid, changes to tyrosine, which is a non-essential amino acid. It can be inside our body, phenylalanine. Whereas phenylalanine is required in the diet. What is the enzyme involved here? It is phenylalanine hydroxylase. Okay. Also requires a cofactor, which is tetrahydrobiopterin. Okay. Phenylalanine hydroxylase, in the presence of tetrahydrobiopterin, converts phenylalanine, an essential amino acid inside our body, into tyrosine, which is a non-essential amino acid. Okay? Now, if this enzyme is absent, if phenylalanine is absent, or if tetrahydrobiopterin is absent, both the cases, what will happen? This reaction cannot go. Now, go back to your knowledge of enzymes and factors. What are cofactors? Cofactors are which associate enzymes transiently their efficiency. Okay? Enzymes in the presence of cofactors work more efficiently. Cofactors per se do not have any enzymatic activity. Enzymes without the cofactors can also have catalytic activity, but of a very lesser degree. Okay. So now from this knowledge, if tetrahydrobiopterin is, then the degree of disease will be less severe compared to when this enzyme itself is, the cofactor is absent, enzyme will work, albeit a very lesser. But if the enzyme itself is absent, then the reaction cannot go at all. Okay, understood? So, there are two scenarios when phenylalanine hydroxylase is absent and when tetrahydrobiopterin is absent. This is severe and it is called classical phenylketonuria. This is less severe and it is called variant phenylketonuria. Understood this? Got it? The difference? Now, phenylalanine we have understood. What is this nomenclature, phenylketonuria? Now again go back to amino acids. What did we read there? About transamination reaction. How conversion of alpha keto acid, alpha amino acid occurs. Transamination. And this is a reversible reaction. Alpha keto acid to alpha amino acid and vice versa. Transamination. Alright. Now here this amino acid is what? It is phenylalanine. Now whenever the enzyme is deficient, there will be accumulation of phenylalanine and there will be deficiency of tyrosine. Understanding, there is deficiency of tyrosine and there is accumulation of phenylalanine. Therefore, this accumulated phenylalanine is then going to convert to phenyl pyruvate. Alanine converts to pyruvate, so phenylalanine will convert to phenyl pyruvate. What is this? This is an alpha keto acid. Phenylalanine is an alpha amino acid. This phenyl pyruvate, which is a keto acid, this will then be excreted in the urine. So in the urine there is presence of phenyl ketones. Okay, phenyl ketones with a phenyl. Therefore, it is known as phenyl. Yeah, understood the nomenclature part. Okay, next is the signs and symptoms. Very important. Okay, very important are the signs and the. Let us quickly discuss these. First, we'll see excess of phenylalanine will happen. Will be excreted in the urine, leading to phenylketonuria, which will cause musk odor in the urine. Nappies. Next, what? Because phenylalanine is a large neutral amino acid. Okay, so what is a large neutral amino acid? I'll just show you. This is the blood-brain barrier. Okay, it prevents easy flow of all the substances in blood into the brain. Okay, so this is the blood and this is the brain. Blood carries different substances. So if there will be access, if there will be direct access of blood to the brain, happen all the toxins and all have direct entry, and they can be deleterious. What happens is there is a barrier, different levels, and this barrier prevents direct or uninhibited of substance blood to the brain. Okay, so what does it have? It has channels. Channels allow certain pass through or not. So there is a channel that is the large neutral amino acid transport. It allows different large neutral amino acid flow from the blood to the brain. Okay, so there are different types of large neutral amino acids, phenylalanine, pan. Okay, so now suppose there are a lot of large neutral amino acids. Okay, but phenylalanine is in excess. Of phenylalanine. Phenylalanine is excess in phenylketonuria because it's not getting tyrosine. Okay, it in the diet. The density of phenylalanine has increased so much that only phenylalanine crowd around the large neutral amino acid, they will be transported into the brain. So it is preventing the transport of other large neutral amino acids. So what will happen? Large neutral amino acids are a neurotransmitter secretion and for the health of the neuron. Now what will happen? There will be neurological symptoms. Okay, and what are these neurological symptoms? Developmental delay. We saw in the picture, neck holding was not there, delayed milestone. Okay, there can be ADHD, that is attention deficit hyperactivity. Okay, that the child will repetitively action, all these things. Deficit hyperactivity disorder, just to gather attention. Okay, and there can be seizures also. There will be cognitive impairment also. Understood all these neurological. Okay, and why is it occurring? Because of excess of phenylalanine. Hence, symptom is what? Excess of phenylalanine. Symptom. Okay. Now, next is due to deficiency of tyrosine. Deficiency of tyrosine. Now, tyrosine is needed for what? Tyrosine in our body gets converted to melanin. Melanin is the pigment that gives the hair and the skin their color. So, if tyrosine is deficient, melanin will also be deficient. Deficiency of melanin is going to albinism. Understood? So, these are the symptoms that are present in mild. Okay, understood? Now, what is the heel prick that we were talking about? See, so first of all, what we'll see is, okay, for the diagnosis of phenylketonuria from day 3 to day 7 of birth, what is done is the Goose's test. Which test? This test. Very important, guys. Please. It is done through heel prick. You saw in the picture. It is done through prick. Okay. What? This scar is from the heel prick. Got it? This one. Prick. The heel. Next, so what is done is from day 3 to day 7 after birth, prick the heel and take a small drop of blood, and that blood is tested for absolute value of phenylalanine, phenyl pyruvate. Phenyl pyruvate is high, very high, phenylalanine, absolute value of phenylalanine very high, and the ratio of phenylalanine tyrosine is also very high. This is diagnostic. This is suggestive of what phenylalketonuria. Okay, what that picture was representing. Now, one very important thing. In the beginning, I told you about classical phenylketonuria and variant phenylketonuria. So, how do you differentiate whether it is phenylalanine hydroxylase deficiency or it is due to deficiency of hydrobiopterin? Also very simple. Phenylalanine is converted to tyrosine. Reaction of what? Phenylalanine hydroxylase is in the presence of hydrobiopterin. Okay. Now this tyrosine is converted to L-dopa. The presence of tyrosine hydroxylase and tetrahydrobiopterin is the cofactor here as well. This L-dopa is converted to dopamine, which is what? A catecholamine. Tyrosine is required for catecholamine, and this dopamine inhibits prolactin synthesis. Okay, understood this much? Tyrosine gets converted to dopamine, and this dopamine inhibits prolactin. For this reaction also tetrahydrobiopterin as the cofactor. Okay, now first scenario is if phenylalanine hydroxylase is deficient. The first scenario, classical phenylalanine. If phenylalanine hydroxylase is deficient, then what happens is phenylalanine cannot be converted to tyrosine. Okay, then what will happen? All these symptoms of phenylketonuria. Now, if you give this person tyrosine and you measure the serum prolactin levels, what will you find? Phenylalanine hydroxylase was deficient. Phenylalanine, but tetrahydrobiopterin is present. Okay. Now you give this person tyrosine and you measure serum prolactin. Given him tyrosine, this enzyme is functional, this cofactor is present, will form dopamine. Dopamine will inhibit prolactin. Here prolactin will be low. So the first scenario, when serum prolactin is low, then the diagnosis is what? Phenylalanine hydroxylase deficiency. Second scenario is when there is deficiency of tetrahydrobiopterin. Now what happens is phenylalanine cannot convert to tyrosine. Okay. Now this tyrosine, if you give him tyrosine from outside, the tyrosine will also not be able to convert to dopamine significantly, because again this enzyme also requires tetrahydrobiopterin as the cofactor. Also significantly. Now dopamine is not present to inhibit prolactin synthesis. Now if you measure the serum prolactin levels, the serum prolactin level is high. Now the diagnosis is deficiency of tetrahydrobiopterin. So did you see how the same clinical features can be distinguished according to the deficient enzyme or the cofactor? Understood this? This is all about phenylketonuria, which is important to understand. So with these two images, we have discussed the whole of phenylketonuria. Okay, this image, so please look at the images carefully, because when these images in the examination like these, and you will be asked what is the associate these images to arrive at a diagnosis. Okay, these kind of questions, application based questions, can be asked of. Ready, and please develop your clinical skills. Always think, and that you can do only by revising something again and again. Okay, phenylketonuria, the symptoms that are present, signs, types of phenylketonuria, why is it called phenylketonuria, signs and symptoms are attributed to phenylalanine or decreased tyrosine. Then what is the basis of the symptoms that are occurring, the Guthrie test, and how do you differentiate between phenylalanine and tetrahydrobiopterin. Okay, now I hope you have understood this. Okay, so let us conclude this session, and we'll Unacademy app right now. Just after this session, I'm going live right now in 1 minute. Live Academy app, that is when to start PG. Go to the Unacademy Learners app and go to the NEET section. Look up for Shivangi Shukla, and there you'll find that will be that session. All right, thank you guys. Bye bye. See you at 11 p.m. I have that is there as well. Bye. See you.